Here at Grady, we have some standard precautions that control the spread of disease and minimize the number of healthcare-associated infections. Here are the most important ones. The World Health Organization has set guidelines for when to wash your hands. Clean your hands before touching a patient, before performing a clean or aseptic procedure, after an exposure risk to body fluids and after glove removal, after touching a patient and their immediate surroundings, and after touching an object or furniture in the patient's immediate surroundings, even if you didn't touch the patient. The World Health Organization has also set guidelines on the hand rub procedure. The fingernail policy for clinical staff requires all employees to have clean nails no longer than a 1/4 inch. Artificial nails are not permitted. We also use transmission-based precautions, which are additional forms of protection. To stop the spread of infection agents that are transmitted by touching, follow hand hygiene protocols before and after patient care. You should also wear gloves and a gown when entering a room. To stop the spread of C. diff, norovirus, diarrhea, or other enteric diseases, follow hand hygiene before and after patient care. And wear gloves and a gown when entering the room. Use soap and water for hand hygiene, not alcohol rub.
Wait, you'll need to wear a gown too.
I do?
We think the patient has norovirus, so you'll need gloves and a gown.
Oh yeah, that's right. Thanks. To stop the spread of infections that are transmitted in tiny droplets from coughing and sneezing, like influenza, follow hand hygiene protocols before and after patient care, and wear a blue surgical mask upon entry into the patient's room. Discard it after use. To stop the spread of infection agents that are transmitted through the air, follow proper hand hygiene before and after patient care. Be in a negative pressure room with the door closed at all times, and wear an N95 respirator mask when in the room. Always use a Grady-approved isolation gown when there's potential for exposure to blood and bodily fluids. And if you're exposed or have a needle stick, notify the 5 Sticks hotline immediately. Healthcare-associated infections, also referred to as HAIs, are infections that patients acquire while they're in a healthcare setting. HAIs are completely preventable when we follow all these protocols. These precautions also fight the transmission of multi-drug resistant organisms, commonly called MDROs, which are bacteria that have become resistant to certain antibiotics. They are an increasing threat to public health. We need to keep ourselves safe and healthy so that we can keep our patients safe and healthy. Healthcare workers who develop signs of communicable diseases can seek care from Employee Health Services, or EHS. If you get sick, you may be excluded from work duty and placed on a work clearance. You'll need to show documentation from your physician to return to work. Employee Health Services is here to educate and train healthcare workers on infection control. They're available as a general resource and for group trainings. For additional information on our policies and procedures around infectious agents, find the Infection Prevention and Control Department link on GradyNet.